This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on 9TV.
A woman's biological clock can be her worst enemy. After the age of 35, a number of risks may come into play as one attempts to become pregnant.
Later age pregnancy is pregnancy that occurred when you are 35 and above. Ideally, you should get pregnant in your 20s. That's the optimal, good quality of egg that you will get.
Women who decide to have their first child in their mid-30s may have to deal with fertility issues, which include a steady drop of egg supply. Other concerns include the possibility of giving birth to children with genetic abnormalities like Down syndrome.
Of course, later age pregnancy, you will have more possible complications like hypertension, diabetes, preterm deliveries. Aside from the girl being older, getting this illness before getting pregnant, the chances of having a threatened miscarriage, nagbabantangkunan, is also higher.
From arranging a preconception appointment and putting together a good diet and exercise plan, these tools will go a long way in preparing you and your baby to a better and healthier future ahead.
We can lower the risk of complications by first seeing the doctor before you get pregnant, once you want to have a baby, and start your folic acid. And generally, you should be healthy also before getting pregnant.
How does age affect fertility? What other health concerns are associated with later age childbearing? Find out the answers tonight on MedTalk.
Joining us tonight is Dr. Virgilio Castro, an obstetrician gynecologist at the University of Santo Tomas Hospital. He's the chairman of the Maternal and Prenatal Welfare of the Philippine Obstetrical and Gynecological Society. Also joining us tonight is Dr. Ramon T. Reyes. He's an obstetrician gynecologist at the Makati Medical Center. He's the past president of the Philippine Society of Maternal Fetal Medicine. You may join the discussion by calling our hotline at 548-4678. Evening, doctors. Welcome to MedTalk.
Good evening, Angel.
Our topic for tonight, advanced maternal age, advanced maternal health. I'll cut to the chase and ask how old is too old to bear a child?
Well, advanced maternal age, let's peg it at the age of 35 years. As the woman grows to bear her first child, okay, we peg it at 35 years of maternal age. But as you grow older, the more risks you'll be into.
And this is for the woman's first pregnancy.
First pregnancy.
Okay. If a woman has had children in the past, is there still a risk? Are there still concerns of having a child at a later age in life?
Well, the risks are varied, but compared with those who had children already, if you're past 35, the risk for overall complications are lesser than a first-timer.
In your practice, doctors, do women nowadays delay their pregnancy or delay childbirth?
They tend to delay their pregnancy at a later age. It's for the principal reason that they will tend to focus on their career first before they embark on their first pregnancy.
So the choice of career over family sometimes is a priority for these women. No. Doctors, let's talk about the reproductive system or the reproductive organs of a woman in her 20s, her 30s, and her 40s in relation to childbearing. Dr. Reyes, let's start with a woman in her 20s.
Yeah, the best time according to the books is in the early 20s. The best reproductive age in terms of pregnancy success, and the number of complications are less. It's like they say an athletic event.
Okay, why do they say it's like an athletic event?
Well, it's kind of physical in all aspects. Taking care of yourself and later on taking care of a baby.
So in your 20s, your eggs are still in tip-top shape, so to
Yes.
speak. You're still very, there are no medical conditions at that age, no?
Yeah.
Well, woman is born with a predetermined number of oocytes, as they say. So, pagkapanganak pa lang, 300,000 ang oocytes na nandoon.
Okay.
But look, at childbearing age, let's say at 20 to 25, yung 300,000 mo na oocytes is narrowed down or reduced to 30,000.
Okay.
So as you grow in age, konti na lang yung itlog na pagpipilian. And so, you know the consequences. Hindi na maganda ang pregnancy in terms of chromosomal problems, in terms of incidence of miscarriage.
Okay, so in your 20s, no, so the quality of your eggs, as you mentioned, no, is there a number na the best age in your 20s to get pregnant?
Well, about the age and fertility, because there are two things, fertility and, complications that comes with pregnancy. With fertility, I read in the literature that your chance of getting pregnant per month when you're in the early 20s is about 20% a month. But it drops down to less than 8% if you're past 40.
Okay, so after the 20s, you've a higher chance of getting pregnant. In your 30s, what are the chances of a woman becoming pregnant?
May I add?
Yes,
to that?
please, doctor, go ahead.
Between 20 to 30 years of age, yun ang optimum time mo to get pregnant. Ika nga, marami pang itlog na magandang quality.
Okay.
So, ang fertility rates between 20 to 30 years of maternal age is about 400 women getting pregnant in 1,000 exposed women. So, 400 out of 1,000 women may get pregnant at this particular point in time. Yun ang fertility rate na tinatawag natin.
Okay, mataas ang fertility rate
Mataas.
na yan, ano, doctor?
But look, at 40 years of maternal age, bumaba na yun to 100 women getting pregnant out of 1,000 exposed women.
That's a big drop.
Big drop.
Big drop talaga siya. Pero bago tayo dumating sa 40s, in your 40s, no? How about the age of 30 to 35? Kasi from what you mentioned kanina, parang there's a cut-off, no?
Ang cut-off natin is 35 actually. So, we internationally, ang 35 years of maternal age is the high-risk age, ika nga, start of high-risk age.
Okay.
But as you grow in age, maternal age, doon ang maraming lumilitaw ang miscarriages, chromosomal problems like pagnganganak ng Down syndrome, at saka yung fertility rates mo, bumababa na rin. So chances of getting pregnant is lesser at an advanced maternal age.
And we're talking about first-time pregnancy.
Yes.
Yes.
First-time pregnancy. So ang cutoff is 35. After 35, same risks as when you when you're 35 years old up.
Mataas na ang incidence ng mga complications and the fertility rates drops down.
What are some of the complications na pwedeng mangyari sa babae when she decides to get pregnant at this age or that bracket, yung age bracket na yun?
Well, ang principal concerns nila riyan is the incidence of chromosomal problems, yung mga nanganganak ng may genetic problems like yung Down syndrome na tinatawag natin. Mataas na rin. As you grow in maternal age, palagay natin, meron akong statistics sa 365 pregnancies in a 365 Down syndrome in mothers 35 years of age. Ikumpara naman natin yan sa age 40. Magiging one Down syndrome ang mother na nagkakaroon ng sa 80 pregnancies ang lumilitaw na nagiging Downs. At 45 years of maternal age, 1 out of 8 nagiging Downs na yon.
And you'll help us understand that a lot better, no? And the other risks and complications brought about by having a child in your 40s. We'll talk about that when MedTalk returns.
If you want to have a baby, it will greatly help if you simply relax. Studies suggest that stress can hinder you from bearing a child, as it can interfere with brain signals that can notify your body to ovulate.
We're back here on MedTalk, still talking about advanced maternal health. Doctors, before the break, we were talking about Down syndrome as a complication, would you say, of later age pregnancy. Why again does this happen? And you gave us statistics already, Dr. Castro.
So if I may repeat again, at 35 years of maternal age, first pregnancy, there is a one Down syndrome out of 365 mothers at 35 years of maternal age. Kumpara naman natin yon sa 40 years of maternal age. One Down syndrome will appear in 80 pregnancies. At 44 years of maternal age, 1 in 8 pregnancies will turn out to be Down syndrome. So as you grow in age, the higher the incidence of Downs.
Yes,
Okay,
Dr.
why the
35?
magic number 35? Because this is an idea from the Western medicine, because at age 35, this is on the basis of prenatal diagnosis, because in the, in other countries, they abort babies with chromosomal abnormalities. We don't, of course, but we take it from them that the 35 is the magic number, basically because of the number of live-born babies with Down syndrome, which is the most common chromosomal anomaly that is born alive. And in fact, they can grow to adulthood. 50% of them will live beyond 50. And it's the most common. In other countries, it's a burden. To us, they're welcome. We just want to be guided if the baby hasn't any condition like that.
And a baby is always a blessing, no?
Yes,
Yeah.
of
So
course.
talagang it's a very happy addition to the family. As you've mentioned, they grow up to adulthood.
But to model the issue, now in reality, it's magic age 35. Your individual risk will increase. Compared with a woman of, let's say, 20, you have a risk of 1 out of 2,000. For a woman, age 35, it will be 1 to 300. And at age 40, it would be closer to 100, 1 out of 100. But in reality, when you look at the population of Down syndrome being born, 70 to 80% are born in women less than 35.
Less than 35?
Yeah, we attribute the aging of the egg as the cause of Down syndrome and other chromosomal abnormalities. But there are unfortunate incidents, when the chromosomes develop in a woman or a man, and this is passed on to the offspring. We call that translocation. It's about 70% will come out less than age 35. So that's the reality.
And are there tests that can be conducted when a woman is pregnant to find out any genetic abnormalities of the baby?
The good thing about prenatal screening and testing, it has come to our shores, and it's available as early as in the first trimester. Before, we do the congenital scan in the second half of pregnancy, 20 weeks, 24 weeks, and we miss a lot. But with current testing, we can predict the occurrence with an accuracy of about 87%, sometimes 100%. Out of the population that you screen, 1 to 2% will only turn out abnormal. So it's a test of actually an assurance.
Okay.
So they won't have sleepless nights the whole pregnancy.
And they can have a healthy and stress-free, so to speak, pregnancy.
Yes, starting in the first 3 months of pregnancy.
What other health problems can a woman in her woman rather in her 40s experience or have?
Well, we have success in pregnancies and complications in the mother. Well, regarding successful pregnancy, we have miscarriages before the first half of the pregnancy is finished. The rate of abortion increases as the age increases. And this is spread across after age 25. Stillbirth is another matter. Baby dies inside, we don't know why, and that increases as the age goes up, above 30, especially after 40. And then we also have complications in the baby, low birth weight and preterm delivery, which is the #1 killer of our babies.
What labor when a woman in her 40s goes into labor? Are there also health concerns?
Yes, an elderly mother, as the saying goes, a woman with the age of 20 to 30 is what we call spring chicken. Mothers in labor with the age of 40 to 45,
Is no
the
spring
uterus
chicken.
cannot contract as expected. They're no longer spring chicken. So with that, they're prone to what we call dystocia problem. And dystocia problem, yung problema sa panganganak, hindi na humihilab ng husto, hindi na rin nagpo-progress as expected ang labor curve. And so they almost always end up with a cesarean delivery.
Is it recommended already that a woman in her late 30s, early 40s, immediately request for a cesarean section? Or should they try to go into labor upon the recommendation
encourage
of their
them.
OB-GYN?
We encourage them to have the normal vaginal birth of delivery over cesarean delivery. But nowadays, we have modern armamentarium. While they are in labor, we have electronic fetal monitor, which detects problem, not only of the mother, the uterus not contracting properly, but also of the baby. If the baby has what we call fetal hypoxia, the old term for that is fetal distress. That's the only time we intervene with the cesarean delivery.
Oh, okay. So you encourage pa rin that they go
Yes.
through the
Yeah.
normal birth
Normal
process. Yes. Doctors, we have a question this time from Twitter. I have maintenance meds for my hypertension. Can I still take them even if I'm pregnant?
Well, it depends
Dr.
on the medicine she's taking. Well, there are medicines that we don't use for pregnant women. And we have a lot of antihypertensives that are safe. So we have to know before we can answer what particular type or the name of the generic name of the
We have to
drug.
find out first the
Yeah,
name
we
of
have
the
to
medicine.
find out first.
Hypertension, because in your late 30s and early 40s, medical concerns come up, medical health problems come up. So is it really the age or the medical condition, so to speak, that you have accumulated as you age?
If we classify hypertension into two types. There are mothers, even before they get pregnant, are already hypertensive. So that's
Even
one.
if they're in their 20s
chronic
or
hypertension, we call it. And the other one is the onset of hypertension beyond 20 weeks, that's beyond 5 months. Ibang tawag doon, preeclampsia. But the two conditions could coexist in one single patient. So iba na naman ang treatment noon. So we have ways of monitoring which is which. And so we single out some therapeutic medications specific for each problem.
Okay. So hypertension, aside from other medical conditions that a woman in her 40s may have, no? There may be diabetes as
Diabetes is number one.
Maybe a heart problem as well that you do not have in your 20s or even in your early 30s. Is that correct?
It's very unfortunate that pregnancy is a normal event in life. However, we have found out, and this is the understanding in obstetrics, that as you age, even if you're not pregnant, genetic diseases like hypertension, things that you have inherited, from the family, like diabetes, can come out. And pregnancy hastens their appearance in your life because pregnancy itself can be pregnancy-inducing. It can induce diabetes.
The gestational diabetes.
Gestational
no?
diabetes.
Prior to getting pregnant, you did no manifestation of your
Yes.
diabetes. Tapos when you get pregnant, saka siya lalabas.
Yeah, if you have family history, it can come out in a pregnancy.
Are there advantages to getting pregnant in your 40s or late 30s? We'll talk about that when MedTalk returns.
The clock was ticking for 39-year-old newlywed Julianne Alonzo. Julie wanted her own little bundle of joy the soonest time possible. Her prayers were then answered when she found out she was pregnant.
Unang nalaman ko na got pregnant, natakot ako because this the stage of risk of pregnancy, 35 and above. Sabi ko gano'n. But I'm still happy because I got pregnant after a month of my marriage. Tapos sabi ko, I do my best in the first try kasi this the first risk na ng pregnancy, development ng heart, brain, yung mga vital organs. So lahat na gagawin ko para sa baby ko.
As a nurse and professor at the San Juan de Dios Hospital, she knows for a fact that her body needs the full attention to avoid the risks and possible complications of pregnancy.
Pinipray ko na lang talaga ngayon is na okay yung baby ko. Kasi ngayon ko lang, this week ko malalaman kung buo ba siya o buo ba siya, may heartbeat pa siya. Kasi may heartbeat na dapat eh. These weeks na, 7 weeks, dapat may heartbeat na siya. So malalaman kung okay ba o hindi.
Fortunately for Julie, her family and friends are there to support and guide her as she welcomes the newest member of her family.
We're back here on MedTalk, still talking about advanced maternal health. You may join the discussion by calling our hotline at 548-4678. Doctors, we've seen in the video Julianne, 39 years old, about to be a mom, first time. And she's all these concerns that you've mentioned earlier.
First time mom.
First time mom at 39, and she's in her first trimester. What can you advise or maybe tell us more about the tests that can be done so to put her at ease with this pregnancy of hers?
Well, she has to see her doctor right away if she has a positive pregnancy already. And then the doctor will usually do the screening tests. And I advise the doctor also to request for an ultrasound at about 11 to 13 weeks. That's the first line. And usually sonologists will do the measurement of the nuchal skin of the fetus. And from there alone, you can rule out a lot already, especially Down syndrome. If the thickness of the nuchal skin is about less than 3 millimeters, that is already a reduction by more than 35% of her risk for a Down syndrome and other chromosomal anomalies.
And this test can be done in your first trimester?
Yes. At
And
11,
do you follow that up in your second and third trim?
well, just a routine scan at about 24 weeks, the usual scan that is done on a pregnant woman.
Other tests, Dr. Castro, that can be done?
If I may add up to some tests, between 15 weeks, that's roughly about more or less 4 months, up to 5 months, we have what we call genetic amniocentesis. It's getting amniotic fluid, ultrasound guided in utero, and submitting the fluid for a karyotype. They analyze the DNA, the karyotype of that particular individual. If there were Down syndrome, let's say, it's a trisomy 21, they can detect the test.
Nice.
That the baby in utero is Downs. Together with the biochemical markers that Dr. Relis mentioned earlier, that the two modalities would add up to the accuracy of the test. Let's say about 87% accuracy
Actually, that's the diagnostic test to confirm the results of a positive screening test early in the pregnancy, just to level up. Well, we do the first trimester screen, that's ultrasound for the nuchal skin, and getting the biochemical markers for Down syndrome like pregnancy-associated plasma protein A and free beta HCG. Then we have a software in our hospital that we use to compute it. Actually computes everything for you. You just input the age of the mother, the age of the father, and then the results of the nuchal skin thickness and the PAP-A, the free beta HCG. Lo and behold, you will have a numerical risk calculation. The cutoffs for high risk is 1 to 270. So if your result is 1 to 2,000, you can be assured that you don't need any more tests like what Dr. Castro mentioned because you're free of that. The false positive rate is false negative rate is very, very low.
You mentioned the age of the father that you input for this type of test. Is there a certain cutoff also for a father to bear a child, for a man rather, to bear a child? High risk ang babae, 35 and up. How about for the man?
The literature I have come across with, this is international literature, 40 years of paternal age is also the start of advanced paternal age. So while the mother is 35, the father should be at least 40 years of paternal age.
Okay, so does it also hold true na high risk rin, or there's a lower sperm count for the man at age 40 and above?
Yeah, at age 40, the fertility rate of that man is also decreased. And there will also be chromosomal problem. The poor quality of spermatozoa will come into play, and you may have chromosomal problems like Down syndrome, trisomy 18, trisomy 15. All of these are at risk.
Yes,
And
Dr. Reyes.
the ultimate test that came up recently is the NIPT, non-invasive prenatal testing. And that can come as early as 9 weeks. And you get only maternal blood, and then you send it. It will give you the full karyotype, which is very accurate.
So what do you hope to find when this test
everything
is done?
can be like Down syndrome and other chromosomal anomalies can be picked up by that test. And if that is necessary to investigate a woman whose family has genetic diseases, that can be included. Actually, this test is also a test of an assurance.
Okay.
Because remember, we don't have abortion in the Philippines. Most of these tests are useful only for us to assure women.
Okay, so in your practice, that's part of it, no? To assure talaga the woman, the couple, that this pregnancy will be safe, will be stress-free, so to speak, and a healthy one. Before the break, we talked about the advantages of later age pregnancy. What would be some advantages of having your baby later on in life?
Well, I can see distinct advantage of advanced maternal age. It's for the economic reasons.
Okay.
The women are stable by this time financially and maybe matured emotionally to carry on a pregnancy.
How about physically? And advantages physically? We know our bodies better in our 40s. We understand it a lot better.
Maybe in terms of having been diagnosed with all the diseases and they're absent or they're present, then they can be managed instead of a surprise.
Okay. Eating right and exercise. Should a woman still engage in sports activities in her late 30s when she's pregnant? Can she work out? What should she eat? Avoid? Dr. Castro.
Well, let me give you a very short rundown. Eating right. A woman is advised low-salt diet. It should have a balanced diet, protein, carbohydrates, and fats should be in consonance. We have a pyramid of diet that we call, And it should be a balanced diet. Avoid salty things. In terms of exercises, a pregnant woman should avoid high-impact exercises. As far as exercise is concerned, the best form of exercise is walking, at least 30 minutes a day. And also, in terms of avoiding vices, smoking is definitely contraindicated because they tend to deliver low birth weight babies.
And alcohol too.
Oh yeah, I
It's
was
a
about
no-no.
to ask. How about eating fresh food, like your sushis or a salad?
Well, just precautions on contaminated fish. We have a lot, if you Google, there are a lot of, you can identify which are contaminated with possible contamination. And then you can avoid because there are many types. So in fact, this is the information age. You can refer to them, which is contaminated, which has no possible contamination.
And you should avoid that all throughout your pregnancy.
Yes, because they contain the contamination that we fear is mercury and lead.
So we've talked about high-risk pregnancy for those in their late 30s and 40s for first-time moms.
Yeah.
Yeah.
For those who have children already and they're in their 40s, are the risks similar to those who are first-time moms?
Well, if you compare those for first-timers, the complications are, higher.
Okay.
If you compare those who had born children, especially in terms of complications like stillbirth, preterm birth. So what you worry about are the medical complications on the woman, like diabetes and hypertension. That there's no difference.
Okay, no difference whether you're in your late 30s,
Yes.
early 40s, first-time mom or third-time or second-time mom.
It's just a complication on the baby.
Doctors, any final word or tips to all our viewers, to all those who are planning to have a baby in their late 30s, early 40s, or to those who are already pregnant at this age? Let's start with you, Dr. Castro.
Well, since our topic is advanced maternal age, I would peg ideal age to bear a child, first-timer, is between early 20s up to 34 years of maternal age.
So early 20s up to 34.
34, yes.
Okay. Thank you, Dr. Castro and Dr. Reyes.
Well, the reality, according to the priest that I have heard in weddings, it's fate.
Okay.
So I hate to say it, it's very hard to control. So if ever you have plans or are pregnant already in advanced age, it's the problem of your obstetrician.
Okay.
It's not yours.
It's not yours. They can refer their
Yeah.
concerns to
We are
their
3,000
OBs.
in number in Philippine Obstetrical and Gynecological Society.
Thank you for that statistic. So
Yeah.
they can be rest assured that
They're
all
spread
their
yeah.
concerns will be addressed, and whatever problems they may have, they can consult with you guys.
Yeah,
Okay. Thank you once again, Dr. Castro
You're
and
welcome.
Dr. Reyes.
thank you.
All right. Worried about that scar brought about by your cesarean section or maybe your stretch marks when you were pregnant? When we come back, we'll give you tips on how to get rid of that scar. You're watching MedTalk here on 9TV.
It's never too late to have your first child. Just ask Hollywood celebrity Salma Hayek, who was blessed with Valentina Paloma at the age of 41, back in September 2007. Other A-listers who got pregnant after the age of 40 include Celine Dion, Nicole Kidman, and Halle Berry.
We're back here on MedTalk, still talking about advanced maternal health. This time, we focus on another postnatal concern, scarring. Are there ways to heal the skin and reduce the scarring from within? To answer these questions, or to answer those questions, we have with us Dr. Jean Gerald Pionco, a plastic surgeon from the St. Luke's Medical Center. Good evening, Dr. Jean. May I call you Dr. Jean?
Sure. Good evening, Angel.
So what happens to a woman's body during pregnancy that causes a scar or all these marks?
Well, first and foremost, pregnancy induces several hormones. These hormones change the aspect of the elasticity of the skin and also healing of wounds later on. These hormones also come into play and they promote dehydration. That's why it's important for pregnant women that they are advised to keep on hydrated and keep on moisturizing by putting moisturizing creams and drinking lots of fluids also.
This is a habit that they should form while
being
pregnant, no?
Yes.
Or the first moment they find out that they're pregnant.
Yes. Moisturize and
moisturize.
hydrate right away.
Okay. So what are the long-term effects of these scars? In the event that, you still moisturize,
Yes.
you hydrate yourself, pero genetics, di ba? Sometimes hindi talaga maiiwasan na magkaroon ka ng scar.
Yeah. Aside from factors that, genetics come into play and inevitably you have scars.
Yes.
Usually, well, first and foremost, kasi the scars, when you look at it, it's unsightly. Sometimes it's itchy. And of course, you develop low self-esteem, self-confidence that you don't want to show it. So these are the probably long-term and psychological effects of scarring after pregnancy.
It's more psychological.
More
no?
psychological.
Physical, you can do something about it, no?
Physically, you can do something about it, but some people, they develop low self-esteem knowing that, they have scars and they don't want to show it.
We would, in this day and age of social media and selfies and,
Yes.
showing what you have or your post baby body, no? In their 20s, what is the difference when it comes to healing in their 20s and in their 40s when it comes to these scars brought about by pregnancy?
Yeah, when one gets pregnant and when one is younger, of course, the skin is still tighter. But once you get a certain age...
Aging talaga, no?
Yes.
Okay.
Once you get to a
it's the
certain
aging
age...
process you can't avoid.
Once you get to a certain age, you tend to lose elasticity of the skin. There's what we call the dermal barrier. It shows, it breaks down. That's why some pregnant patients, they present agad with marks, unsightly marks. Because number one, it's part of being pregnant.
Okay.
And aging also comes into play.
And other women are keloidal, no? More than others.
Other women are also keloidal. That's also genetically induced.
But other women, when they give birth, no scar at all or no marks at all.
Yes, there are women whom we call, they're probably blessed or gifted.
Okay.
But majority, they complain or that's their concern. Doc, I still have scars after and what will I do? So majority of patients end up with unsightly scars.
So what will they do, doctor?
Okay, usually, aside from prevention, when we say prevention, that's when they find out that they are pregnant. We ask them to hydrate and moisturize. After which, if the scars show and then they give birth, that's the time we promote or we recommend several treatments. One treatment that I can recommend is Contractivex gel. Well, this gel is this gel contains different components. It contains acetylene extract, which is an onion derivative, which promotes anti-inflammatory reaction, thereby healing, giving the effect of faster wound healing. It also has heparin. Heparin promotes regeneration of new cells, and allantoin. Allantoin naman promotes moisture. When there is moisture, there is better healing, and well, our target is to promote flawless healing. So those three components are targeted to improve scars.
Okay. At what point do we apply the mentioned
Okay, at what
remedy
yes.
or treatment?
Actually, immediately after you give birth, you can actually apply Dermatix. You can apply it 3 times a day for 3 months. Later on, if you apply it late, you can also apply it 3 to 4 times a day for the next 6 months.
So if you're not able to apply it immediately after giving birth, maybe you have other concerns, no? Aside
Yes,
from that
when
scar,
you're-
of course, you're a new mom, and then you have to take care of your baby. For example, 3 months after giving birth, is it still okay to apply?
3 months after giving birth, it's still okay. It's still fine to apply, but you have to apply it longer. So you can apply it 3 times a day, but you have to apply it for 6 months.
Do hormones after giving birth play a role in scar healing?
Yes, after giving birth, there's still an upsurge of maternal hormones, and these hormones still promote the dehydration and delayed wound healing. So, in effect, we apply these scars to promote healing of the wound and to promote moisture also.
So it also depends on the healing process of
Yes,
the mom,
of
no?
the mom.
Kung gaano kabilis or gaano katagal. But it's best that you apply it right
Yes,
away.
it's best that you apply it right away. There is no contraindication once you give birth. Readily apply it. It's
Include
easy
it
to
na in
apply.
your daily regimen.
Yes.
How about for breastfeeding moms? Is it also okay
that's
to
a good
apply?
question. Breastfeeding moms, their concern kasi is, there's something foreign or there's something new. Contractubex, this is a topical gel. So it doesn't cross the blood barrier. It doesn't even go to the baby during breastfeeding. So it's recommended, it's safe.
That's good to know. How about scarring of women in their 20s and in their 40s? I think we talked about it earlier, but let's talk about it some more.
Yes. Okay, there's a difference. So when you scar
In
after
your 20s, what do
pregnancy-
you notice during the women in their 20s who have given birth and when it comes in terms of scarring, and women in their 40s?
Okay. In terms of scarring, basically it's almost the same. The problem is healing.
It's the
Yeah,
healing,
it's
it's
the
not
healing,
the scarring.
It's not the scarring.
Okay.
If you scar when you're 20, you scar when you're 40, there's much the same effect or the same problem. But once you're in the later part, once you're a little bit aged,
More mature age.
Yes, yes.
Okay.
Beautifully aging, let's put it that. You,
That's a nice way to put it.
You want to develop faster healing. You want to get rid of the scars immediately. So this is where you can, apply the Contractubex as well. But I'm not saying that when you're 20 or younger, you can also apply Contractubex.
So you, whether you're in your 20s
Yeah.
or in your 40s, it's not the scar.
It's not the scar.
Again,
Yeah.
it's the healing.
It's the healing process.
And the remedy or the treatment that
Yes.
you apply or
Yes.
you do to yourself
Do to yourself.
to hasten
Hasten.
the healing process.
Yes,
No?
or improve the scars that you find unsightly.
Unsightly scars, women talaga, they're very
Yes,
conscious
yes,
now.
yes.
Maybe in their 20s, they're not as, maybe you can't say that as well, no?
Yeah,
20s, 30s, 40s, 50s, and 60s. It's something that you should take care of, no? Your
Yes.
physical appearance as well.
It's more of, psychological impact and self-esteem issues. So whether at a particular age or not, you still want to look good and feel good. So, you apply something to your regimen to make it improve and, make yourself look better inside and out.
So thank you for helping us. It's a choice, no?
It's a choice.
It's
yes,
a choice how you would like to address those scars
Yes.
after giving birth. But you've given us a good choice and you've helped us understand why we should apply
Yes.
the type of treatment to our scars. Thank you so much,
Yes,
Doctor.
it's my pleasure.
Thank you once again, Dr. Jean Gerald Tionco, for enlightening us on the importance of scar healing. We'll see you again next Tuesday, 7 p.m. here on MedTalk, your scheduled on-air consultation on 9TV. This is Angel Jacob. Good night, everyone.